Okay, hi, it's Dr. Lorn. I'm just going to give a brief demonstration of how I would do suboccipitals for recurring headaches and or migraines when all other diagnostics, there's nothing more serious going on, or there's no explanation as to why the headaches are occurring, whether that's hormonal, food sensitivities, and whatnot. This is purely about suboccipital induced tension headaches at the base of the skull. So what I do is obviously you find the base of the skull, which would be right along here. And I'm looking for sensitivity at the base and then just up over the edge, which would be right here. So if this is just under, then this is right on the edge, and then of course up just over the edge. And I have had many, many experiences where I do this for migraines that cannot be diagnosed any other way, that are actually, and this could be for decades, that are actually base of skull tension headaches. So this isn't the angle I would use, but just so you can see it. So the base right over the edge, and so this is where the small muscles are living. And so I am finding the spot. I put the pressure on it, make sure it's tolerable, and keep pressure on it. And sometimes this could go on for minutes at a time until the patient tells me that the pain is virtually gone. So it might be a 7, 8, 9. And then after I hold it for, it could be very short, could be 20 seconds, could be 30 seconds or more, that they tell me that it's now down to a 3 or less. I do not move around until there is a release or a lessening of the pain. I will not friction it. I won't be rubbing back and forth. I won't do circular movements. It's purely just straight on pressure. And I've gotten the best results with this, and especially with migraines that have no cause that can be detected. So a lot of the time, they'll get a lot of relief from this. And I know she's feeling it, but she's not saying anything. So you hold this and you wait until it releases, or until they say, okay, I don't really feel it much anymore. And you in a very tight, small area, try to find the very next spot that has the tension. Patient will usually confirm for you very readily as soon as you hit the next spot. I will do this. It may take more than one session, from anywhere I can find spots, from left to right or right to left. There are a couple spots in here, even though she's not showing headaches. This is a demonstration model. And I will work across it. It may take me 45 minutes. It may take me an hour. And I'll release the ones I can find to the patient's tolerance. And then after that, I'll either stop, take a break. We'll let a few days go by. We'll see how they're affected. Sometimes it's only on one side. Sometimes it has to be both sides to get the relief. So that's the very short version of how I deal with suboccipital headaches and or migraines. Even if they could be traveling, they could be along the top, and I will still find this effective. But it's worth trying when you have a case where nothing else seems to be working. Later.